Cody to help guide us and provide perspective on the ongoing challenge with COVID. I wanted to convene all of us because there's so many questions that many people have, and they've emailed our office, asked our office, and asked me. And I thought, why not go to the experts to answer a lot of these questions? And of course, I will be happy to answer what the federal government is doing. But Dr. Cody, I'm very proud of her leadership. About 2 years ago, we were just talking before this live stream started. She was one of the first people who really warned not just the Bay Area and the state of California, but the country about the danger of COVID, understood how quickly the disease can spread, understood how important it was for us in those early days to take decisive action of restricting large gatherings and even having a temporary a lockdown so that we could get things under control, and that we were able to not have the same amount of hospitalizations as deaths as many other parts of the world and even parts of the country. And her leadership for that has been recognized across the country. And it's been a difficult 2 years for everyone, certainly for her and all of her staff, and for our healthcare workers, our nurses, frontline workers, our doctors. I mean, I understand the exhaustion of having to deal with this disease, that just when we think we're turning a corner, another variant comes. But I just want to thank all of our healthcare professionals, our frontline workers, our public servants in the public health office for your dedication to our community for the past 2 years. We would be in a much, much, much worse place if it weren't for all of your service. So on behalf of all the constituents, thank you. Dr. Cody, I appreciate your joining us. And let me begin by asking, what can you tell us about this new Omicron variant? How many cases have been identified in Santa Clara County, and are we past the worst of it, or how do you see the next couple weeks unfolding?
Yeah, thanks for the questions. It's so good to be here, and thank you for inviting me to join you. In Santa Clara County, our trends tend to look like most of the Bay Area region, and the Omicron wave, as you've noticed, really just kind of took us by the collar and sent us spinning rapidly up. I am pleased to say that looking back, we now know that we are past the peak. It looks like it probably happened somewhere between the 7th and 10th of January. And we're just beginning to see early signs that our hospitals may be seeing a little bit of a reprieve. So it's been an extraordinarily difficult several weeks, but I think the spread is beginning to come down. That being said, it's of course still quite high. Most of the Omicron that we see is this dominant variant. We're now, and I think that over 95% of the cases that we see are Omicron. We have just a handful, maybe a pair of cases that are a new subtype of Omicron. We don't really know what that means yet. We'll be learning that in the days and weeks to come.
And do we know if that's more dangerous, not more dangerous, or we don't have any knowledge?
So far, we don't know. It has a different pattern, but so far we don't really know how it behaves. My guess is it's probably going to behave like the dominant Omicron variant. It's just like a subvariant. So, but we'll see. We're following it, of course.
I appreciate that. Someone asked, which I will answer, how much will it cost to implement masks and testing for all initiatives? And Senator Sanders and I have called for it. President Biden has taken action. There's a website everyone can go get at least 4 free tests per household. But I think that obviously is just a start. We need to have far more than 4 tests. It's not enough to have 1 test per person, but at least we're getting something out there. And the president of the White House, I was talking to Jeff Zients, and they're going to have masks at the Walgreens, at the CVS's, at the post post offices in the next week or 10 days. To do all of it, to have testing and masks for everyone would cost about $5 billion, which is a fraction of our federal budget. We should be able to do this. We should have done it, frankly, a year ago. We're behind the 8 ball, but the president now is committed to doing it, and they're making good progress. And I will continue to push for masks, for production of tests, for the production of the antiviral pills, so that we can really tackle COVID. Let's see now, go to Dr. Cody for the next question. You were one of the first public health officers, as I mentioned, tackling COVID protocols in this pandemic. Now, 2 years out, have we made it past the greatest dangers? Do you think things are going to get better after we get past this peak on Omicron? And what is your biggest concern?
Thanks. Well, I'm an eternal optimist, so you have to know that as I answer these questions. I would say the first year was extraordinarily difficult for everyone because we didn't have a vaccine. We just didn't have that many tools. We didn't have widespread testing, masks, treatments hadn't come online, and we certainly didn't have a vaccine. And that's why we had to use other interventions to keep everyone safe. So that was enormously difficult. I think that the last year, where we've been working so hard to get everyone vaccinated, has been, there's been, for me, a sense of relief to have not one, but 3 safe and effective vaccines, particularly those 2 mRNA vaccines, the Pfizer and Moderna. I think that, to be honest, the biggest challenge now is us, because our whole population, there's a level of exhaustion, a level of trauma with everything that everyone's been through. And yet the road ahead still has a lot of uncertainty. We don't know what's going to come next. We've been through 5 waves here locally. I imagine there will be more waves to come. So it sort of goes in peaks and valleys. And what we don't know is exactly what the next peak will look like. Will it just be a little hillock, or will it be another huge mountain, and how complicated it will be? So I think it's the greatest challenge for all of us is that we don't have we can't quite see around every corner. We don't know what's going to come, and we're quite tired. And so this is when we have to pull together and rededicate ourselves to being adaptable and flexible and prepared. And I think that distributing masks and tests is really critical. That will prepare us for whatever will come. And we more is better. Big stockpiles would be super helpful.
Wonderful. I appreciate that. I appreciate your optimism. Let me see, what efforts are you making to work across the aisles during this divisive time in Washington? Any success? Well, we actually had a success today with the introduction of the Competes Act in the Senate. It was already passed. It's the Innovation and Competition Act, and this will put the most investment in science and technology since the Cold War. In our district, we have Intel that just announced $20 billion of new semiconductor fabs in Ohio, in New Albany, Ohio. And this bill would allow more companies to build semiconductor production, to build technology production in America, which would deal with some of the inflation. I mean, one of the reasons car prices are so high is there's a shortage of semiconductors. So this is a bipartisan bill. There are examples still of bipartisan work. And certainly it's important that we do that at a time of such polarization. Well, let's go to you, Dr. Cody. Josh asks, what is the rate of false positives on the rapid at-home tests?
Great question. So the good news is the rate of false positives for the rapid at-home tests is very, very low. So if you get a positive, you can assume that you have COVID and that you need to isolate. You don't need to go get a PCR. The trick is that there is a higher rate of false negatives, and that's because you need a certain amount of virus present in order to turn one of those tests positive. So they're not likely to pick up an early infection. A PCR test can pick up an infection early. The at-home tests won't pick it up quite so early because the amount of virus that you shed hasn't picked up enough yet to detect it. They'll also turn negative more quickly than a PCR test for the same reason. So they're going to catch your infection in a narrower window than the PCR test.
Thank you. And George asked, what is Congress doing to help people afford masks? I mentioned the legislation Masks for All that Senator Sanders and I introduced. We wanted the government to mail everyone a mask, and where people could order it online or call in. The White House thought that would be actually logistically harder to do, and they've said that they want to flood the drugstores, the pharmacies, post offices, places people go with these masks. That I think is a good idea. And the N95 masks, I mean, they're hard to get, they're expensive, so we need to make them as accessible as possible. But to that, and Dr. Cody, I know I get asked this all the time, how long can someone wear an N95 mask? Is that something someone can wear a couple of days or just once or one day, or what is your recommendation on that?
So N95 masks can be reused. Healthcare workers, particularly early in the pandemic when we had a shortage, developed protocols to use them more than once. Generally, we would say if you wear it all day, that you keep it in a paper bag where it can breathe a little bit, and then you can reuse it. The only so 5 days of use, if you're wearing it all day, is about average. Certainly, if any of it breaks or the elastic bands get worn or stretched out where you don't get a good fit, then it's definitely time to get a new one earlier. So the real key with N95 masks or any mask is that you have a good fit, so not too much air escapes, and that you have good filtration. And certainly the N95 masks are at the high end of filtration.
Terrific. Candace asks, are you more likely to test positive on an at-home rapid test when you're symptomatic as opposed to if you're asymptomatic?
In general, you would be more likely to test positive when you're symptomatic, and that's because the at-home tests measure when you have a lot of virus, they're pretty good at picking it up. And in general, but not always, when you have symptoms, you're especially at the beginning of an infection, that's when you're shedding or producing the most virus. So not a perfect correlation, but pretty good.
Right. Robert asks, where can I find free at-home COVID tests? And we'll put this in the chat, but if you go to www.covidtest.gov, every home in the US is eligible to order 4 free at-home COVID tests. It takes about a week to ship. You can also call 1-800-232-0233. And again, we'll put that information out. And look, I get that 4 tests are not enough and people need more than 4 tests, and we're working on getting more, but 4 is better than nothing. And we're at least they're starting to get these tests out. Let us go to the next question for you, Dr. Cody. You've already answered this about when is Omicron expected to peak in the Bay Area. When do you think we can get back to what the numbers were before the Omicron surge? Do you have a sense of when that would happen, how long it'll take to get there?
We're looking at patterns in other parts of the world that are highly vaccinated and highly boosted as we are to try to get a sense for what it might look like. And one pattern that I'm seeing is in some places like ours, the downslope isn't quite as steep as the upslope. In other words, our way out may be a bit more of a meandering course. We may not just come out of it as quickly as we came into it. I think another question is, what will our baseline look like? Will it look like it was before the Delta surge? And that's when we had really almost no spread of COVID? Or will it look like after Delta when we reached a plateau, but it was pretty high? I do want to say, because no one's asked this, but this is coming up in many other conversations, for the whole pandemic, we've been very dependent on looking at our case counts. So pretty much every county has a dashboard where you look at the case counts. You can look at the federal data or state data and case counts. And as we use more of the at-home tests, of course, those aren't recorded in our case counts. So our case counts become a bit less reliable in helping us track where we're going. We are lucky here in that we have a wastewater surveillance epidemiology. And so we actually track the levels of virus in the wastewater. It tracks extremely well to the case counts. And I think it's something that we'll be relying on more as we go forward.
Good.
Tell us where, how far down do we go? What's our new plateau?
That makes a lot of sense. Olivia has asked, what options are there for free testing other than ordering at-home tests? And Olivia, there are a number of test options. First, if you have private health insurance, your insurance has to cover by law, by the president's order, up to 8 over-the-counter at-home tests. So make sure that you're calling your insurance company for the reimbursement. They are required to cover 8 tests. And then there are other options to get tested for free, including at pharmacies and different testing sites in our district. The Santa Clara County and Alameda County have done a great job in having a number of these sites. So you can go and get tested for free at these sites. Let me go now to a question for Dr. Cody. When will there be vaccines for young kids and those under 5? I know Dr. Fauci had said a month, and then I heard today Scott Gottlieb saying, well, no, it may be late March. Do you have a sense of when that could happen?
I've heard the same. My information also comes from news reports, and it sounds to me like sometime between a month or a month plus. The vaccine manufacturers will bring their data before the FDA. I think that the questions, of course, are around what's the right dose for kids under 5, and what's the right series? Do they need 2 shots, 3 shots, 4 shots? What do they need to get the adequate level of protection? So I'm just watching the news as we all are, and it seems to me that in the next few months, at some point, we'll know more.
Good, and I know parents are anxious, and it's a challenging time, and I empathize as a father, but I think it's so important. That's why for all of us to take all the precautions we can, and not just for the young kids, but also for those who are immunocompromised and who are at risk. So important that we be mindful of everyone when we're out and about, and recognize that our actions are affecting people who may be more vulnerable than we are, and that we have a responsibility to everyone in our community. Darian asks, why is it still important to wear masks when almost 70% of people in California are vaccinated? Dr. Cody, do you want to take that?
Well, Congressman, I think you just covered that beautifully. And we talk about the layers of prevention, and every layer is a little bit leaky. So that's why we have to pair them together. And the vaccines are amazing, absolutely amazing at keeping us out of the hospital. But the amount of infection that they prevent sort of depends on, what's circulating. So for Omicron, definitely reduced our chances, but not 100%. And that's why we pair it with masks. So if you wear a mask and everyone around you wears a mask, that layer adds a very important layer of protection. And other important layers, of course, are testing, which we've talked about. If you test and know if you're infected, even if you don't have many symptoms, you can isolate yourself and protect those around you. And then ventilation is also important. Not being an indoor crowded space that has poor ventilation. That's another really important layer. So We have very high vaccination and booster rates here in our area, which is amazing. But right now, particularly with the surge of Omicron, it's not enough to protect us and to protect others. And that's why masks are important as well.
Very well said. And, vaccines protect against hospitalization, against death, but haven't been able to completely protect against transmission. And so
yeah, they reduce it, which is important. And
Yes.
when we look at our rates of infection among people who are unvaccinated, vaccinated, but not yet boosted and boosted, you can really see the difference. It does help really reduce the chance of being infected. But people think about, well, I know so many people and they're vaccinated and boosted and they had a breakthrough infection. Well, part of that is because most everyone around you is vaccinated and boosted. So that's what you're going to see. But the rate is actually lower. Yeah.
Do you have a sense, and I don't know if what percent of vaccinated, boosted, what the breakthrough infection rate is? Is it 5%, 10%, 20%, or do they not?
Well, I was just looking at the data for Santa Clara County, and the rates among people who are unvaccinated are close to 1,000 per 100,000. They're 900 and something, really, really high. And the rates among people who are boosted are around 100. So there's about a tenfold difference. Yeah.
On infection itself, not even the severity.
On just for rates of infection, right? And then when you look at rates of hospitalization, it's also, a huge, huge difference. The vaccine is very, very, very protective as far as hospitalization, and extremely effective in preventing you from dying of COVID, which is also, of course, very important.
What are the current guidelines for daycare centers for kids under 5 years old? And this person wonders, are 5-day quarantines mandatory for children who've been in close contact with someone who has COVID or tested positive for COVID?
We're following the state guidelines for schools and daycares, so they're not particularly different in the Bay Area or in Santa Clara County. And I have to say that the guidelines around when you isolate and when you quarantine have gotten kind of complicated. And so I can't tell you off the top of my head without looking exactly what they are for daycare. But the general rule of thumb is that if you test positive, you isolate for at least 5 days, and then test after that to make sure with a antigen test. If it's negative, you can feel pretty good and you just keep wearing your mask. If it's positive, of course, you want to stay isolated. And the rules around quarantine are similar. You keep yourself away from others, make sure you don't get sick. And then if you have a negative test after about halfway through, you can feel pretty good that it's okay to go back.
Wonderful. You've been so thoughtful. I want to end with just sort of your general reflections. What do you say to people? It's been 2 long years. People have not been able to travel, often haven't seen their families, or may have seen their families once or twice in these 2 years. They're frustrated with school closings or having to quarantine their kids for extended periods, juggling careers, juggling responsibilities, and just tired. And some of them, people are saying, well, can we just get back to normal? But obviously, the COVID doesn't just listen to our wishes. And so what is your general message to the community, which I think has done a very, very good job about making it through 2022 and doing so with some sense of hope and optimism?
Yeah, it's a great question. And I think it is important to acknowledge that everyone is quite tired. And this has gone on for a very long time, much longer than anyone might have guessed back in February 2020, or even late January 2020, when the first cases were coming. It's quite unexpected, and it's been trying for everyone. There's no question. I think I like to look at the bright side, and I've seen just such a sense of community and such beauty in many people and how they've reacted and what they've done. And I just try to hold that. That's something that keeps that keeps me going. That being said, I know that it's not over. I mean, we've learned a lot about how to live with COVID. We've learned a lot about what works and how we have to pair things together. And we've also learned that we have to continue to be adaptable and flexible, and that we have to, unfortunately, the reality is we have to continue to live with quite a bit of uncertainty, because we just don't know. But I my experience, this is my home. I grew up in Santa Clara County. I've always lived here. And our community has been extraordinary, absolutely extraordinary. And it's very inspiring. It's very inspiring. So if we just think about all the extraordinary things that so many people have done so many times over such a long period, that's what I hold on to, and that's what I want to. That's how I sort of fill my bucket and get energy to head into the future.
Well, thank you, Dr. Cody. You've certainly been one of those extraordinary people in your leadership, and I agree with you. Just seeing our community come together and helping provide food and meals for those who needed them in the time of greatest economic distress, and will continue to do that. And all of the healthcare workers, our nurses, our healthcare professionals, our doctors who at their own risk are going in to take care of patients time and again. And our frontline workers are keeping things running, making sure we're still getting food, making sure we're getting supplies. Just want to thank them. And I couldn't agree with you more about the sense of resilience of our community, and very proud of our numbers of vaccination. And those are boosted. I think we're one of the leaders in the country in terms of all of what we have achieved. So thank you for setting the right tone for us and giving us a great strategic direction. Thank you for answering so many people's questions. And hopefully we can do this again when we can have more to celebrate. And I do hope that 2022 will see a better year than the previous one when it comes to COVID.
I do too. Thank you.
Thank you.
Mm-hmm.